Instead of asking a nasty, snarky question like that, you should ask a real question.
Mr. President, did you or your family sell stocks?
No, I don't have stock. I own things that...
Make any alternates to investments in advance of this?
No, I don't even think about it. You know, it's very interesting that you ask a question like that. You know, nasty question, and yet it deserves to be asked, I guess.
Yesterday, Jared Kushner said the notion of the federal stockpile was it's supposed to be our stockpile. It's not supposed to be state stockpiles that they then use. What did he mean by our?
Oh, what are you asking?
And given the fact that taxpayers from
What's that?
every
It got
state
you.
pays
I got
for
you.
it.
You
No,
used
it's
the
not a
word
gotcha.
hour. It's such a basic, simple question, and you try and make it sound so bad. You ought to be. You ought to be ashamed of yourself.
No,
you know what? You ought to
by
be
the
ashamed.
way, Secretary
It's such a
Azar-
simple question. You just ask your question in a very nasty tone.
What do you say to Americans who are upset with you over the way you downplayed this crisis over the last couple of months? We have it very much under control in this country. The coronavirus is very much under control in the USA. It's going to disappear. It's like a miracle. It will disappear. March 4th, we have a very small number of people in this country infected. March 10th, we're prepared. We're doing a great job with it. It will go away. Just stay calm. It will go away. What do you say to Americans who believe that you got this wrong?
And I do want them to stay calm. It's people like you and CNN that say things like that, it's why people just don't want to listen to CNN anymore. You could ask a normal question.
Would you also weigh in on this issue of hydroxychloroquine? What do you think about this, and what is the medical evidence?
That question?
Yeah.
Maybe 15 times. You don't have to ask.
He's your medical expert, correct?
He's answered that question 15 times.
Is it possible that your impulse to put a positive spin on things may be giving Americans a false sense of hope?
No, I don't think so.
Misrepresenting the preparedness right now.
No, I don't think so. I think that I think it's got
the not yet approved drug.
Such a lovely question.
What do you say to Americans who are watching you right now who are scared?
I say that you're a terrible reporter. That's what I say. I think it's a very nasty question, and I think it's a very bad signal that you're putting out to the American people. You ought to be ashamed of yourself.
My first question is, you said that you don't take responsibility, but you did disband the White House Pandemic Office, and the officials that were working in that office left this administration abruptly. So what responsibility do you take to that? And the officials that worked in that office said that the White House lost valuable time because that office wasn't disbanded. What do you make of that?
Well, I just think it's a nasty question.
Ventilator manufacturers are doubling, tripling, even quadrupling their production in some cases.
That's true.
And yet medical experts and some of these manufacturers are predicting that there will still be shortages of tens of thousands of ventilators. Is it time for you to level with the American public that there likely will be shortages of ventilators in some cases?
We think that we have a good amount ready to move. I mean, literally, like an army. They're ready to move to any hotspot. But some of the ones that you're talking about, always a nasty question from CNN, but some of the ones, because I think that, frankly, because you know what, you've asked that question about 10 times over the course of about a month. Thousands of lives by
time that you bought. The argument is that you bought yourself some time. You didn't use it to prepare hospitals. You didn't use it to ramp up testing. Right now,
you're so disgraceful. It's so disgraceful the way you said it. Let me just listen. I just went over it. I just went over it.
In an unprecedented crisis.
Nobody thought we should do it. You know you're a fake. You know that. Your whole network, the way you cover it, is fake. And most of you, and not all of you.